topic, interdisciplinary collaboration, working with nurses, therapists and allied healthcare professionals, moderated by Dr. K. Jitendra Sir, Professor and HOD, Department of Microbiology, Alluri Sitaramaraju Academy of Medical Sciences.
And allied healthcare professionals. I am honored today to moderate this vital conversation about interdisciplinary collaboration in healthcare. Our esteemed speakers of this discussion bring with diverse expertise, and hopefully their insights will inspire us all with a meaningful dialogue. So please join me in welcoming Dr. V. Mahidhar Reddy, a renowned surgeon, Dr. V. Sivaprabodh, an expert administrator, and Dr. Jairam G, a distinguished spokesperson. All the three are at present the coordinators, and one of them is the administrator and chairman of the MU units at the institute. Let's give them a warm round of applause as they take the task to share their perspectives on the theme, skills and as an art of patient care. So we welcome you all. So let's start the program with a brief introduction of the speakers' profiles. So start with Dr. V. Mahidhar Reddy. Dr. V. Mahidhar Reddy is a distinguished surgeon and an esteemed medical educator with an impressive educational background, includes an MBBS and an MS in General Surgery from ST Medical College, Tirupati, along with a fellowship in laparoscopic surgery with additional FAGS and FAIS. His commitment to medical education is evident through his qualifications including RBCW, CASP at RCMet Vizag and ACME at St. John's Medical College. Currently, he serves as the professor at HOD Department of General Surgery at Narayana Medical College, where he is also the MU coordinator. His leadership in both roles exemplifies his dedication to advancing surgical practice as well as medical education. Dr. V. Mahidhar Reddy has an impressive portfolio of 21 publications in various national and international journals. He has also successfully led 2 international research projects as the principal investigator, showcasing his commitment to research and innovation in surgery. As a medical educator, Dr. V. Mahidhar Reddy successfully conducted the APMEA State Conference 2021 in the position of Organizing Secretary. As a MU coordinator, he has overseen the conduction of 2 RBCWs, 2 BCMEs, 1 CSSP, 3 medical education workshops, and 3 medical education guest lectures. Dr. Reddy's active participation in both surgery and medical education through his regular talks, workshops, and research highlights his dual commitment to excellence in both disciplines. We welcome you, Dr. Mahidhar. Next, Dr. G. Jairam, with an MBBS degree in year 1995 to 2000 from AMC Vizag, and also he served as a medical officer in the leprosy unit from 2001 to 2004, and he did his MD Physiology from Guntur Medical College. He worked in Pinnamalai Siddhartha Institute of Medical Sciences as assistant and associate professor, joined in Nimra College from 2015, and presently he is working in the capacity of coordinator MEU, Skills Lab as well as BCLS program coordinator. He is also the head of the Department of Physiology and has an administrative key role, Vice Principal of Nimra Medical College. He has been a keynote speaker at various national and international conferences, and his fields of interest are sleep apnea, yoga, muscle strength training, and to his portfolio he has 20 papers in national, international journals with an additional field of medical education, ACME from Belgaum, JNMC Rural Center in the year 2023. Thank you, Dr. Sir. Welcome, sir. And last but not the least, Dr. Sivaprabodh, Principal of NRI Medical College, Professor at HOD, Department of Biochemistry, NRI Medical College. So he is completed ACME from 2014, St. John's Medical College, Bengaluru, and presently holding the post of the Chairman MU NRI, with previously as a coordinator from 2012 to 2022. He is also a member of BOS NTRHS in PhD and MD Biochemistry. As a field of organizing secretary, he has conducted APMEA conference at NRI Medical College, and his portfolio includes 47 scientific research publications and reviewer of 6 peer-reviewed journals. He has delivered almost 36 guest lectures in different kind of platforms, and presently he is holding the position of the President, AP Association of Medical Biochemists of India, General Secretary APMEA from 2018 to 20, and presently President of ACC LM. Thank you, Dr. Prabhu. So before going to the collaborative discussion, let me highlight to the theme. What is the theme of today? Skills as an art of patient care. So skills in patient care is not merely the application of medical knowledge, but an artistic craft that requires precision, adaptability, and deep understanding of human needs. Like an artist welding a brush, healthcare professionals blend technical proficiency with compassion to create meaningful patient experience. So this art manifests in the ability to listen attentively, interpret subtle cues, and tailor the intervention to individual circumstances. Based on the circumstances, we have to adapt as a teamwork. A skilled practitioner navigates the complexities of illness with fitness, balancing the clinical judgment with emotional intelligence. For instance, a gentle touch or a reassuring word can alleviate the anxiety as effectively as a prescribed medication. Such moments reflect the mastery of care as an art, where every interaction is a deliberate stroke towards trust and recovery. So with this brief introduction of the theme, let's start our collaborative discussion with Dr. Mahidhar. Dr. Mahidhar, what does this interdisciplinary collaboration mean in the healthcare setting, and why do you think it is so important?
So, thank you, sir. Thank you for the inviting me to this program. So, regarding the interdisciplinary collaboration, it's like as the name says, the interdisciplinary collaboration. It's about coming together of the doctors, nurses, the physiotherapists, speech therapists. You have occupational therapists, pharmacists. So, coming together of all these people from various disciplines and delivering holistic healthcare is interdisciplinary collaboration. But one point I want to make clear is, see, interdisciplinary collaboration is more than interdisciplinary care. What we normally follow. So we follow on a parallel lineage. A doctor, a clinician sees a patient, and a physiotherapist is asked for, or a nutritionist is asked for. So everyone will be delivering their services in parallel. But there is no proper teamwork like that. But that is what we do normally. It's a parallel delivery of services, what we call it as a interdisciplinary care. That's what we follow. But interdisciplinary collaboration is more than that. So where you plan ahead, you work in teams, you work in tandem. You don't work parallelly, you work in teams and in tandem. So that is what interdisciplinary collaboration. And so definitely, like you said, the advantage of interdisciplinary collaboration, like we discussed, the holistic care. The biggest advantage of the patient is holistic care. So where it's not only his physical demands, so the social, the other aspects, psychological aspects and rehabilitative aspects of the patient are also taken care. And several studies have shown that interdisciplinary collaboration is strongly associated with better patient outcomes. So what they say, naturally patient recovery is enhanced, and patient satisfaction levels also are found to be more with the interdisciplinary collaboration. And the biggest advantage for the institute is you can, with respect to delivering the services, the resource management, there won't be unnecessary duplication because people are working together, no duplication, no wastage of time. And as a member of the team, particularly the doctors, when you work in a team, naturally you are, there will be professional confidence or professional satisfaction. It will be definitely more, and naturally it gives a good vibe to the doctor, and it reduces burnout also. So most of the doctors nowadays burdened with lot of works. Working in an interdisciplinary team in a collaborative way, it will reduce the burnout also. So these are big advantages. Several studies have shown with interdisciplinary collaboration.
So optimal utilization of the resources. Maximum patient satisfaction.
Maximum patient satisfaction.
So that is interdisciplinary collaboration.
Yes.
Thank you. Very well determined. Sir, Prabhu sir, what are some of the biggest challenges when working across the different disciplines in healthcare, and how can they be overcome? Challenges.
Before speaking about challenge, let me say that as a laboratory physician, my goal is to generate a quality report with accurate value. For that is possible only with my team, with my healthcare team. My team consists of 5 Panchabhutalu, I can say, that a clinician, phlebotomist who draws blood sample, caregiving nurses particularly in wards and ICUs, and the attender who carries the sample from different place to my lab with appropriate precautions, and the technician who performs the test. Without these 5 people efforts, I cannot generate a quality report. So I trust on them. I train all these people accurately to deliver an accurate report. If there is any chain break with these 5 people, definitely a bad report will be generated. That is the main challenge, where inappropriate training or under training of all these people, including clinician also, will generate a bad report. So for clinicians, my plan is that we have clinical meetings. In all clinical meetings, as far as possible, from the diagnostic department, we encounter and we tell that if you have any problem with the lab report, please communicate with us. Don't be silent. Please communicate with us. Then definitely we can resolve the problem. Can I say one example here?
Definitely.
Like recently we started homocysteine parameter in our lab. Previously it is an outsourced parameter. As the number of samples are more, we started in our lab only. So initially the values were very good and the neurologist is very happy who insisted to start this parameter. After 1 month, around 40 days, she facing some problem with the values. All the values are very high. Initially she was silent only, thinking that okay, lab values are good, it is okay, it's an NABL lab, mostly correct only. But when continuously in clinical meetings we are telling, if you have any problem, please come over, please come over. One day she called me and said, all your labs for the past 10 days are high. Sir, please look into that. We went back and we inquired and we had seen the mission and we had seen all our SOP protocols are correct. But there is some problem with the bulb in the mission. So the bulb has to be, for that mission, bulb has to be replaced once in a month. It was not done by the biomedical engineer, and the problem is facing, we are facing that problem. Elevated values are continuous, where the patient is compromised because of biomedical engineer. So then we called all the 4 engineers who are working in our hospital and we said, please think about all the maintenance of the instrument. Not only technician, you also has to look into that. Like that, these challenges we faced and we resolved it with appropriate planning and discussion.
Very well, sir. Being a part of that lab microbiologist also, we feel the same. Right from collection of the sample in the wards or in the ward to ultimate dispatch of the report, sir. A good clinical, that means a rapport with all the team, will give you the accurate reports. And clinicians also, they have a good rapport with the team as a team. Definitely they will be benefited. The patient is the ultimate beneficiary. Thank you, sir. Sir, Dr. Jairam, sir, what role does mutual respect and understanding play in fostering a good teamwork between nurse, therapist, and allied health professionals?
Okay. So good morning all of you. Good to see a good number of awake persons even after post-banquet. Thank you for that. And sir, good respect among the interdisciplinary team like nurses and allied health professionals. When they have a mutual respect to one another, you can ensure a better communication among the team members. And then honesty can prevail with mutual respect. And at the same time, clarity in their roles, if you respect one another. Responsibilities are well displayed. And ultimately, job satisfaction, as already the previous speaker, Dr. Ramprasad sir, has already very elaborately extensively told about the interdisciplinary team. So by that, the job satisfaction, even a continuous learning process also could happen within the team members, and a good workplace environment can also prevail if you, of course, have a respect with each other. So I feel these are the important things that can happen with mutual respect in the interdisciplinary team.
Related, sir. Anything more, anything that means, suppose if any chain is broken up in this mutual respect, what can we expect, sir? Suppose, how can we overcome that?
Of course, see, after all, the healthcare team is working for a better patient outcome. Right? So better patient outcome cannot be expected.
Better patient. So it ultimately reflects upon the patient.
Exactly.
Anything which happens in the mutual respect, any ego stick or anything clashes occur, it reflects ultimately upon the patient and the. Very well, sir. Very well, sir. But Mahidhan, how do you coordinate your care with therapists and allied health professionals to ensure the best outcome during your practice or during the how do you ensure being a surgeon?
Yes, sir. Like the standard good practice, like what most of the institutes follow, particularly when working in an interdisciplinary setting. One is forming an interdisciplinary team. So that is the crux of the entire care. So forming a team, you identify usually one coordinator from your department. You select coordinators from other disciplines, like I said, starting from speech therapist to dietitian, physiotherapist, all the people select coordinators, and forming a team is the main crux whenever we want to work together. The other one is the other good practice what it is described. So not after the care is delivered. So right, once you get a patient, like you are anticipating a geriatric patient or a patient of complex trauma or complex medical condition. So prior to the starting the treatment, the team discusses once. So a discussion session, a common discussion session. So there you will be planning the treatment, how to deliver this treatment, what role each one has to play. So this definitely is a good practice where you can easily coordinate with your members. And once this team is formed and when they discuss about the patient, throughout his course, like starting from pre-operative, per-operative, post-operatively, this team will be working together. And the another one we need to ensure is, suppose we have an electronic health record system. So naturally we give permission to the other disciplines also to access this one. You don't have one also, forming WhatsApp group or sharing the records, sharing the daily progress of the patient. And after discharge also, like patient will come to your OPD, sending him to the other discipline and this feedback loops formation. So these are good practices which we can coordinate to ensure that the healthcare delivery what we are seeing is delivered in a holistic way.
Holistic. Ultimately, holistic approach is the best approach.
Best approach, and here the crux is forming a team. Team. So then, and prior to the treatment starts, this team will discuss the route map for this patient. So that will ensure there will be a complete collaborative care is given to the patient.
Very well narrated, Mahindra. So, Professor, how do you navigate the situations where your professional input might differ from the perspective of nurses or therapists? Suppose your input is differing. How can you make a collaborative effort?
Actually, we are having a yearly training plan will be there. We train nurses, we train phlebotomists, we train attenders also, like that. Particularly with respect to nurses, the attendance for their training plan usually will be low. So then what we did, we directly interacted with the nurses with an example. So we got a sample with mismatch. Instead of P. Venkateshwar Rao, you had drawn the sample from V. Venkateshwar Rao. Because of that, totally values are changed. The treatment plan was changed for the patients. So it is not a blame game. With cool mind and smiling face, we took the report, we will go to the nurse and we will tell this happened in your ward because of this simple problem. So please overcome that. For that, how to overcome, how to inquire the patient before drawing the patient sample, what to do, all those things, we will give training to you. Apart from that, we will give other training also which will be beneficial to you. and at the end of training, we'll conduct one exam and we'll give certificate also to you. So definitely, this kind of communication, interacting directly with the nurses will improve and we can overcome the problem of
Regular
attendance,
training sessions.
so that finally outcome will be better. So like,
Continuous training programs.
and motivating them to attend for the training programs.
That's the biggest task.
Yeah.
Attending is the biggest task.
Biggest task. For that also we are having a plan
Motivation.
and motivation and will make. So finally we can overcome and best outcome can be.
Okay, I think this will be definitely helpful, sir. Sir, Jairam sir, do you feel that current health education programs adequately prepare the professionals to work in interdisciplinary teams? If not, what could be improved? The current training programs.
So almost every institute, at least in India, are aware of that the interdisciplinary team is essential and needs to be taught. But is it happening? I would say a big no. At least personally, I haven't seen in my institute or any of the neighboring institutes. If it is being done, it's appreciable. But how can it be implemented? And in what way?
Barriers, sir. What could be the barriers to that implementation?
Yeah. So first thing is, if you take the MBBS curriculum, I don't think any of the competencies this interdisciplinary team have been incorporated in. Or the nurses or other allied health professionals were included in our competence. At least I don't know whether other competencies in clinical subjects, whether it is included.
Definitely it is not there.
It is not there. So we can incorporate this interdisciplinary team into that competency, and together they can be taught. That is one. The other is real life scenarios. Never they were exposed to real life scenarios as a team.
Definitely.
Maybe individually they were exposed. Nurses in their part they are exposed. The MBBS degree holders they were exposed. But together, collaboratively, they were not exposed altogether to the real life scenarios. At least to the simulated environments.
No, definitely, sir.
That is, I think these are the
So
two
like
things.
an ADCOM module, there should be a healthcare or health team module.
Yes, health team module.
Because right now MBBS curriculum is focused on ADCOM only. So in the part of ADCOM only, they can make a team module. So applied healthcare or
Yeah, we have individual modules.
Modules.
The nursing, they have their own modules. The physiotherapists, they have their own modules. Our MBBS, we have our own.
But how to work in a healthcare team? No module is there.
There's no module.
So that can be suggested, sir.
Yes.
Very well, sir. Very well, sir. Mahindra, one more. What type of training or education is needed to foster effective interdisciplinary collaboration among healthcare? What type of training? ASRAM, sir.
To promote this interdisciplinary collaboration, start with the students. That's what we say. At the students level, whether it is undergraduates or postgraduates, like already we have this ADCOM module for undergraduates. So where we teach about the communication skills also.
Yes.
So naturally when you teach communication skills, as teaching them about working in an interdisciplinary team. So how to communicate in this team by role plays, case scenarios. That can be the ADCOM module communication skills session can be with an eye to promote this interdisciplinary collaboration. That is one area we can think of teaching students. The other one is what some medical schools like outside the country they follow, interprofessionals education. So IPE, so that is what like sir was saying, interprofessionals education is not being, we study about integration. CBME we are discussing about integration, but integration across the disciplines. Like in this team. So if you teach students this interprofessional education where, like sir said, everyone has got their own modules.
Yes.
So in the common areas, so you can identify the modules which have common areas and students taught together. So that is one interprofessional education. That's one we can hit the student level. The other one is team-based learning. So this, I think once we are small group teaching, NMS is asking us to do. One method most of the schools are adopting is team-based learning.
Yes.
So that way, at student level we can teach in this method. But once you come to the faculty, naturally again we need to sensitize them with CMEs and workshops, and specifically designed for this interprofessional collaboration this team skills and leadership skills, because ultimately we need to work in a team, understand everyone's territory, but at policy makers level, that's an after the policy makers,
high level only.
if they can integrate this interprofessional education into the curriculum, naturally that will automatically keep in line and it will promote this interdisciplinary collaboration.
Any difference between undergraduate and postgraduate? Suppose.
So naturally, like postgraduates, for them they are working already in a team. See, undergraduates they study about that one, but postgraduates
Implement.
you can workplace. They are already in the workplace in the clinical setting, so it is easy to teach these things to postgraduates. For that, I have seen one university in Karnataka. What they are following is postgraduates, like how you send them for super specialty rotations. Now DRP, they are sending PGs for at least 10 days to other disciplines also,
Okay.
like physiotherapy. They are sending. Of course, here
Like a team.
ultimately you need to fall in line. You need to see that time teaching hours are not reduced. But that's a wonderful practice. A little exposure, at least 1 week in each discipline,
They have to go and after
they can easily learn.
team building can be developed.
Develop. Yes.
Very well, sir. Well, sir. Professor, can you tell in your experience, how does interdisciplinary collaboration improve patient outcomes? And can you share any data or any evidence? You already said that.
One of the best example I want to say here, life-saving. My colleague Dr. Venkat also here, our experience 20 years back when we are working together in Shantiram Medical College. So where a patient was reported blood sugar of 25 milligrams per deciliter. 25. Severe hypoglycemia. I want to tell the role of interdiscipline. Actually, my technician, after seeing the value, he did not keep quiet. Immediately, he rushed to our cabin and said, "Sir, so and so patient, value is 25." Immediately, we called to the ward. Personally, we called and informed to the nurse. Doctor was not there in the ward, so we informed to the nurse. There, this is called as critical alert system.
Alerts.
In our system, it is there.
NAVL mandate
Yes,
itself.
mandate. So nurse trusted our value because we are having 1 week back only we trained all the set of nurses about all these things, reporting system, importance of sending the sample early, all those things we said. So she trusted our value and immediately she called the clinician, asked about what treatment should be given. So already after informing, within 5 minutes we ran to the ward also to see what is happening. Sister is giving 50% dextrose to the patient.
That's a
Actually what happened, patient is around a 60-year-old man, wife is sitting beside him only. Some problem in giving insulin injections, I think double dose was given. So son went to bring breakfast to the father. He brought breakfast, but as the father is sleeping, patient is sleeping, wife thought like that. He is in deep sleep with sweating also. For that fan was also on by her. But she doesn't know the value is only 25 milligrams. It was informed by the technician, aptly corrected by the nurse. So,
responded.
yeah, this is very good example where I quote this example in all my training to the technician and nurses.
Excellent, sir. Excellent. Because that is a life-saving experience. Jairam sir, are there any ethical dilemmas that may arise when working in an interdisciplinary team? Especially when there are conflicting opinions. Suppose there is any conflict of opinion, any ethical issues may arise. Anything?
Yeah, definitely. When an interdisciplinary team from different disciplines were working, these things do exist. For example, if you take acutely ill patient who doesn't want treatment anymore, patient side, but the physician who is treating wanted to treat a little aggressively. At the same time, the nurse and other social worker wanted to give a palliative care. So here you have a difference of opinions.
Opinions and ethical dilemmas.
Ethical dilemmas.
How can you overcome that? Suppose if there is one nurse is saying, let him go, physician wants to treat.
Yeah. So when such dilemmas exist, these things to be addressed openly at first instance, so that when there is an open ethical dilemma, everything can be discussed honestly, with mutual respect is already existing. So that can be addressed in a smoother,
Collaborative
way. At least.
Thank you, sir. Thank you.
That is one.
So, Mahendra, Dr. A, are there any specific tools or strategies that you use to streamline communication and coordination between healthcare professionals? Any tools or communication strategies?
Hello. Like there are certain tools described and certain strategies we follow. In medical education, particularly in ADCOM module communications, we'll be discussing more about this Kalamazoo consensus.
Yeah, Kalamazoo.
But here, one tool which I was, when I was searching the literature when we had a session in our college, particularly this came from the nurses medical education. So they have one tool called as SBAR. So SBR, it's a communication tool. Mainly the components like situation, background. This mainly, suppose you are working in an interprofessional team, you need to delegate the patient to various disciplines. In that situation, instead of simply handing over the patient, they follow this one, where one person who is delegating to the next discipline, so they will tell the situation, what is the background and what assessment they have done and what they are recommending, why they are recommending. So this is an excellent tool. Mainly this came from nurses medical education. So when we conducted a workshop, when we were preparing the handouts, this is one tool which came a very effective tool for interprofessional collaboration. That is one. The other one is like we discussed the electronic medical records. If you have access to them, and naturally through you give access to your team, interdisciplinary team, so that is a best way where the real-time patient will be monitored.
Yes.
And usually we, particularly the doctors, are requested to share their SOPs, checklists with the other disciplinary teams.
So everyone can follow
So
them.
sharing these tools, but particularly the checklists, what we can see, everyone can follow. And of course, if you don't have electronic medical records, you can again go through some WhatsApp group and other things. But practices like, apart from these tools, practices like, suppose you are counseling a patient, there is a complex surgery, you are discussing the patient's prospects, involve the other discipline members also. So that is one good practice. The other one is the multidisciplinary rounds. So a technician goes for rounds. After some time, a physiotherapist goes. Then a nursing in charge will come. Instead of everyone go together, multidisciplinary rounds. This is one best practice.
Patient definitely highly satisfied at that time.
Yes.
Definitely, sir. Professor, what leadership skills are most important when leading an interdisciplinary team?
There are many leadership roles and responsibilities, qualities, as already our previous speaker Ramprasad sir narrated very well. So, but I feel three important responsibilities for a leader to lead a healthcare team are definitely integrity, communication and adaptability.
Three excellent tools, sir.
So actually integrity, I want to read the definition by looking into it because all these leadership qualities ekado chadivi cheseva, we cannot read and practice. It should come inbuilt. So by definition, integrity is the leaders with integrity or honest, ethical, trustworthy, building trust and credibility with their team. Definitely the best leader should have this quality.
Credibility is most important.
Most important, trustworthy, that is very, very important. Then of course communication. Yeah, communicate with soft words, definitely bring a lot of change. I can say that. And finally, adaptability. Adaptability, very, very, very important quality. Leaders need to be flexible and able to adjust to changing circumstances, new challenges, and in diverse situations. So these are the three important qualities which my healthcare team, definitely we the lab in charges, we follow this to maintain a good quality report always in our labs.
Like
So
war
for-
footage, sir. War footage. You should be on the toes.
Yes,
Anything.
exactly. So adaptability is very, very important. Can I say one more example?
Definitely,
with
sir.
respect to this.
I hope time is there, sir.
Actually, the commonest problem where we encounter is we send the reports to the wards, and ward sisters usually daily 1 or 2 reports will be missed by them. So again they will call to the lab, ask for a new report. which is very hectic thing for our attenders and computer operators to again reprint that report. So for that, long back we had a rule that if any nurse call and request for one more report, 100 rupees fine.
Fine. So, fining.
Because of that, what happened? Long gap was there between labs and wards.
What's
So they are not relaying our values also finally. Then immediately we change the scenario. That is adaptability.
Adaptability.
What we change? We remove that fine. And if any nurse call to us for a re-report, we take the printout and personally lab in charge will go to the ward and inform sister, you asked for the report, please take. But it is giving lot of inconvenience for the other people also. Please take care of the reports. Like that in soft words we convey the message. Like that we did for around 10 to 12 times for different wards. Automatically asking for again reports for drastically diminished. Now it is almost 1 to 2 report per week. It is very much we improved. That is adaptability. We have to change the protocol on and off. Because we are dealing with different disciplines, not with my department. When I am dealing with other departments, I should be so cautious and so friendly. Definitely outcome will be very good.
Thank you, sir. Thank you. It was very good. Sir, Jairam sir, are there any legal challenges that interdisciplinary teams need to aware of, especially in terms of scope of practice and confidentiality?
Yes, there are challenges. I do want to the Shivaprabhat sir, as he is referring to so many examples, I'll just refer one example.
Definitely.
From a rural background, in a rural health setting, even there the team works, right? Interdisciplinary. Of course, with a single medical officer. So one patient who is of 60-year-old has come from a village, of course maybe a diabetic, for a small surgery called a circumcision. Right? So one of the team member happens to be from the patient's village. Okay? And of course the doctor, family physician of the patient, he will not reveal anything. Definitely. And it is taken for granted. But on the next day, entire village knows that this man, so-called the patient, has gone some surgery. But the people, the rural side, they were not aware of circumcision. Right? They thought it was some family planning operation. How come a 60-year-old has underwent a family planning operation? Except the family members, every other people knows that he underwent operation. So where does this has happened? It has to be confidential, right? It has to be preserved.
Because the team member only, it was broken up.
So what I wanted to suggest here is we cannot take it for granted, especially the team leader, whoever is, whether doctor or whoever it is. It cannot be taken for granted that everybody were taken care of the this legal complications and all. If the same patient, he can sue, right?
Because of breakage of confidentiality.
Breakage of the
And
confidentiality.
to the surgery was circumcision.
Yeah. So before a formation of this interdisciplinary team, each and every member has to be aware of the laws that were existing, all the ethical things that were existing. At least if they doesn't know, the team leader has to
Discuss in prayer about
in
it.
prayer. Okay, and each roles of there should be a clarity in their roles at least.
Very well,
So
very
this-
well example.
Okay.
Nice example also. Mahendra, can you tell me how do you handle the situations when there's a lack of agreement or conflict between team members of this? As Sar said, I think Sar is going to be a good example.
Yes, sir.
When there's a conflict.
So whenever you work in teams, definitely there will be conflicts here and there. See, like again, whenever there are such type of conflicts, the best way is first you steer the discussion towards the what patient needs that particular time, what is right for the patient. So that way first you try to resolve the conflict at near the patient, let the patient what is best for the patient, that will be done first. After that, because there is a conflict now, this team has to work for other patients.
Yes.
So you try to moderate the discussion between these team members. Preferably what we do is better to call senior faculty from those disciplines.
Yes.
And we ask these people who are at loggerheads to reflect upon what has happened.
What has
See,
happened?
most of these conflicts are due to these communications, hierarchical issues, when proper roles are not assigned. naturally when they try to reflect upon the situation, so some conflicts they resolve on their own. So one will naturally
Time will resolve.
you will find what is the problem. But if there are issues with respect to the treatment protocols, so naturally we have whatever the standard protocols is, whose discussion is in that particular line, we say he is right and we follow that particular protocol. We need to refer to the standard protocols.
Protocols and guidelines.
These type of debriefing sessions where they are made to reflect upon will definitely resolve the conflicts. But the first one is let what is right for the patient, that is to be done first. So
As the patient
ultimately,
requires.
they need to work in a team, and see, interdisciplinary, like I told, it's not simply delivering care. There should be change of mindset, because now instead of working in silos, they should work in synergy. So then only the real goal of interdisciplinary care will come out. Yes.
Thank you, Madam. Professor, how can you see the interdisciplinary collaboration evolving in the next 5 to 10 years? And what innovations or changes do you anticipate?
Definitely a lot more change is coming over. Previously with respect to teaching also, it is teacher-centered, change it to student-centered. Now patient care also totally patient-centered now. So outcome-based approach is coming up. With respect to teaching, already broken the walls between all disciplines. The same thing I expect with respect to interdiscipline, some curriculum has to be incorporated in UG also.
UG.
Definitely PG, by the practice they will learn. In EG, some sensitization should be there. It will come, hopefully. By 5 to 10 years, definitely interdisciplinary approach will be there. Giving importance to the technicians, nurses, so must be there. Lot more changes there. In future also it will be there. And with respect to your next question, innovations, so all these innovations, interdisciplinary approach, what my co-speakers said, definitely all those things should be practiced in future.
Definitely.
Definitely it will give a lot of improve. So only the thing is what we talk, all these things should be in practice in future, will give a lot much better outcome to the patient care.
So we can expect as early as much.
Also.
Sir, the speakers are ready to take any questions from the audiences. We are ready. So if you have no questions, madam, nursing dean madam is there here. The principal sir is there. So if there are no questions, we can have a conclusion to remark of the session. Yes, sir. Conclude. So to conclude, sir, present discussion, the important takeaway point, sir, collaboration is the key. What we discuss is the key is the collaboration, clear communication, clarity of the each role in the team, and interdisciplinary training, and patient-centered care, support to work environment, and continuous improvement. So these are our take-home messages for working as effectively as an interdisciplinary for the patient care as a holistic approach. Sir, so
Defining the roles of each discipline by appropriate training, then only it is possible.
very good, sir. Very good. This was effective, sir. So I thank the audiences for their patient listening and active participation. And once again, I thank all the speakers for the valuable contributions for today's discussion. Thank you, Mahedar. Thank you, Jairam sir, and thank you, Prabhu sir. Thank you very much.
Thank
sir.
you very much for the opportunity.
Thank you, sir. Thank you very, very honored.
Relevant, and today's session has reinforced just that. We request Dr. Jitendra sir to give away mementos and certificates to speakers Dr. V. Sivaprabodh sir, we invite Dr. Chebrul sir to come on the stage.
Definitely myself and Chebrul are very good friends. Interdisciplinary team and inter-college team also.
D. Mahidhar Reddy sir. Under Dr. G. Jayaram sir. We request Dr. Srinivas Chebroli sir to give away certificate to Dr. Jitendra sir.